learning
Yes.
how to become a more effective worker
Yes.
in her post.
And she went into this area where there was very little family planning uptake. And after we trained her on this contraceptive update, she, training where we took her through a 2-week course training, she got very enthusiastic because she said, even I myself as a nurse have never been exposed to these issues. I never knew that it was this easy for me. And I think she has 4 or so children, and she doesn't even live with her husband because she's in a hard-to-reach area. The husband is doing business somewhere else. So she went into this area and she started talking to these women and really identifying her story with their story. And because of the cultural issues, women would shy away from family planning methods and use of the same. So children have streams of children, or those who can, maybe they have several pregnancies, but maybe they have 2 or 3 children, but they have had 6 pregnancies, which is the same process really. So she established this clinic and befriended the women around, talked to them in the evening, encouraged them to come to the clinic, and where she thought that they were fearing to come to the clinic because they would be sort of talked about because they had visited these clinics. Then she would visit them in their homes and take these contraceptives, which she has been trained about, and she would explain this is what happens to this method, this is what happens to this method. And just the contraceptive uptake just went up from visits to the clinic, family planning clinic, which were about 2 a month. They shot up to 250 different women a month, and it was clear immediately. It was completely clear. So these are the kind of stories that we would like to be associated with this as IntraHealth, that we have helped these nurses, first of all, realize the needs and how she can meet her needs herself, and empower her to make certain important decisions. And then you can see how it cascades down, because she believes in it, she takes it up, and then she then passes it on, from a very personal perspective to the clients. So these are the kind of stories that we would like to be known for.
Absolutely. I know the story of that health worker, Susan, who after a training in family planning had these incredible results, whereas, I don't know, they more than, I think it was over 25-fold increased the number of clients, because once through their training they became convinced about the importance of family planning. And that story is actually very interesting because we see that a lot. We see a lot of health workers who, after going through the training, see the light. And those are, in fact, the most powerful advocate, those that have come to the realization that, wow, this is something that I need to, that is extremely important. So in fact, yes, there was this one worker who, after the orientation and initial training in family planning, had just dramatic results. And we've had several cases. I witnessed some other cases where the training of healthcare workers is just helping. Rwanda is a case in point that a lot of people are talking about right now, following the genocide. And after our initial investment in training the health workers, we are now seeing family planning programs. The contraceptive prevalence rate was under 4% right after the genocide. Right after the genocide, 4%. So basic 4%. After 3 years of a program, the recent DHS that was published, which is the Demographic Health Survey, show that Rwanda now has 27%.
Wow.
Dramatic increase. Dramatic increase, which I think a good part of it can be attributed to preparing health workers and working
the baseline health
with
workers.
Community health workers. So it is very clear to us that in the presence of severe shortage of health, we don't even talk about physicians, because the shortage of physicians is so severe. But in the absence in the presence of a shortage of healthcare workers, including midwives and nurses, then it makes a lot of sense to invest in community health workers, in really even in lay people, lay categories of workers who could still have a great role in sensitization or education of population or referral. Great. Absolutely.
But these are people who are very distant from us. Why should we here in Westchester County care so much about the health and well-being of people in distant lands?
You know, I actually don't think they are that distant. I think the world is continuously getting smaller, and I think global health and that really should be the focus. I think the idea is that everyone on this planet gains from a healthy population. And a healthy population, we cannot have healthy population if we have these large disparities between the West and the developing world. So I think everybody gains because the world is interconnected. And healthy population in the developing world means, in my opinion, better trade relationship. It also means better education, because then our students are better exposed to the real world. I think tourism, for example, gains much more, because then the populations that are healthy are more likely to be open to tourism and make tourism a better experience. So I think if we look at all of those things, I think the world is much smaller, and I think we are much closer than we appear to be. I think the difference that the oceans put between us is kind of an artificial difference, especially these days of age, because of the progress being made in telecommunications, new communications technologies, use of cell phones, televisions, and all of this.
I was stunned at the number of cell phones and TVs in Kenya.
Yes.
Pape, you've given us a wonderful summary of why we should care.
Yes.
But we've only been able to skirt over the many aspects of IntraHealth work. Where do people go after this program for further information?
Our website, www.intrahealth.org, actually provides lots of information, including very specific information in the areas of programming that we are involved, as well as individual country programs. So that would be a good site to visit.
And most of your programs are USAID funded, or funded by through the State Department?
It's USAID certainly is our largest funder, but also the Center for Disease Control, CDC, and the Gates Foundation is supporting our work in India and recently in Senegal. And then we get very appreciable support from the Hewlett Foundations and the Packard Foundations. So, and individual donors, private donors as well.
Well, Pape, I want to thank you very much. You've given a superb overview of the importance of the work that IntraHealth is doing, and a superb picture of U.S. generosity, U.S. aid at its best. Not just makes me feel good handout, but empowering people in Ethiopia, in Kenya, in Mali, throughout the developing world, to take control over their own economic and political destiny by enabling them to build systems which provide for sustainable and accessible health care for all. As we saw at the Tika Hospital in Nairobi, good health is wealth,
Yes.
and the key to a brighter future.
Absolutely.
Thank you and good
Well,
night.
it was my pleasure, Fran. Thank you for giving me the opportunity to share some of the work we're doing. It means a lot to us. Thank you.